Thank you for joining us today. My name is Aubrey Davis, and I'm the Regional Director of Development for Partners in Health based here in the Chicago area. We at Partners in Health are thrilled to be co-hosting this important conversation with the Invisible Institute. I'd like to start by thanking all of the Partners in Health and Invisible Institute supporters who are joining us today for your ongoing support. None of the work we do would be possible without you, truly. And I'd also like to welcome all of you who are joining us for the first time. We're really glad to have you with us. A couple of tech notes. First, please note that today's conversation is being recorded. Also, at the end of the conversation, there will be time for a few audience questions. So if you'd like to submit a question, please feel free to do so via the Q&A button at the bottom of your screen. And now it's my pleasure to introduce our moderator and panelists. Since we only have an hour today, I'll try to keep this brief, but needless to say, each of them is remarkably accomplished. First, our esteemed moderator, Dawn Turner. Ms. Turner is an award-winning journalist and novelist, a former columnist and reporter for the Chicago Tribune. She spent a decade and a half writing about politics, race, and class in Chicago and beyond. She has written commentary for a number of leading media outlets, held a number of prominent fellowships and positions with institutions such as Harvard University, and is the author of 2 novels, the award-winning Only Twice I've Wished for Heaven and An 8th of August. Her memoir, The 3 Girls from Bronzeville, is forthcoming from Simon & Schuster in 2021. And now for our panelists. Dr. Thomas Fisher is an emergency medicine physician at the University of Chicago, where he serves the same Chicago community where he was raised. He's a former health insurance executive, led segments of Affordable Care Act implementation for Blue Cross and Blue Shield, and served as a White House Fellow at the U.S. Department of Health and Human Services as Special Assistant to Secretary Kathleen Sebelius. There, he worked on ACA regulations and led the development of the HHS Action Plan for Reducing Racial and Ethnic Health Disparities. He holds degrees from Dartmouth, University of Chicago, and Harvard. His forthcoming book on restructuring the healthcare system will be published in 2021 by One World, an imprint of Penguin Random House. Jamie Kalven is an award-winning writer and executive director of the Invisible Institute. He has reported extensively on patterns of police abuse and impunity. He was the plaintiff in Kalven v. Chicago, a groundbreaking case that led to the Illinois Appellate Court's ruling that documents bearing on allegations of police misconduct are public information. His reporting first brought the Chicago police shooting of teenager Laquan McDonald to public attention, and he co-produced the 2020 film 16 Shots, an Emmy Award-winning documentary on the McDonald case. Lastly, Dr. Paul Farmer is a medical anthropologist and physician. He is co-founder and chief strategist of Partners in Health, a global health and social justice organization. He is chief of the Division of Global Health Equity at Brigham and Women's Hospital, Boston, and serves as the UN Special Advisor to the Secretary General on Community-Based Medicine and Lessons from Haiti. Dr. Farmer holds an MD and PhD from Harvard University, where he is the Colacatrones University Professor and the chair of the Department of Global Health and Social Medicine at Harvard Medical School. Dr. Farmer has written extensively on health, human rights, and the consequences of social inequality, and is the recipient of numerous honors and awards for his humanitarian work. His most recent book, Fevers, Feuds, and Diamonds, Ebola and the Ravages of History, was released last month. Thank you, all 4 of you, for being here with us. We're really looking forward to learning from you. And at this time, Dawn, I'll turn it over to you.
Thank you so very much, Aubrey. And welcome, panelists. Thank you so much for being here. On December 6, 2017, an 11-year-old Black girl from Grand Rapids, Michigan named Honesty Hodges walked out of the back door of her house with her mother and another woman on their way to the store. They were confronted by police officers who were pointing guns at them. Officers were looking for a 40-year-old woman whom they believed had committed a crime. An officer was in the middle of telling everyone to put their hands up when Honesty's mother interrupted them and told him that her daughter was only 11 years old. Still, he ordered Honesty to walk backward, and another police officer handcuffed her and placed her in the back seat of a patrol car. All the while, Honesty's mother was screaming that Honesty was only 11 years old. Honesty herself was distraught. When the dust settled, the Grand Rapids Police Department acknowledged that police officers had acted poorly, and they created a policy named in Honesty's honor, offering guidelines regarding how the police should handle children. Honesty herself posed the question, would officers have treated a white child the same way that they treated her? Last month, on November 9th, the same day that Honesty turned 14 years old, she tested positive for COVID-19. Less than 2 weeks later, she was dead. Now she's one of the country's 285,000 people who have died from the virus. I tell you Honesty's story in the context of today's conversation, understanding pathologies of power in the age of COVID-19. I wanted to knit together this whole idea of public safety and public health, because the same communities that are hit hardest by the virus are the same communities where institutional systems, such as the police, have long failed them. These are poor communities that are food deserts, hospital deserts, places where garbage pickup lags, where investment is non-existent. Paul, we just heard about Paul's new book, Fevers, Feuds, and Diamonds, Ebola and the Ravages of History. And he wrote the epilogue back in April when most of us, we were still very new to COVID. Paul wrote that even though COVID-19 is a respiratory virus and everyone has to breathe, it was not going to be the great equalizer. It would affect poor people differently. It would ravage vulnerable Black and brown populations where people could not social distance, where they could not work from home, communities where people are often called essential workers. Paul didn't write about Honesty Hodges, but he knew her neighborhood. Tom Fisher, who is an emergency room doctor at a hospital that serves marginalized people, Black and brown people, he was not surprised that Black and brown people would be disproportionately affected by COVID. And Jamie Kalven, who was not an epidemiologist or an emergency room doctor, he was not surprised because he also has worked in abandoned communities. And he knows that institutional forces that have their knees on the necks of residents. And that's what we're talking about today. Paul, I'm going to start with you because you coined the phrase Pathologies of Power in your book by the same name, and you talk about deprivations globally as well as in this country, but also another phrase you coined, structural violence, and how it influences extreme suffering. So you've said that the most basic right, the right to survive, is trampled in an age of great affluence. Human rights violations are not accidents. And I want you to explain what you mean by that and tell us what it means in the context of COVID-19.
Thank you very much, Dawn. And let me just start by saying it's really a privilege to be here with Tom and Jamie particularly, and with you. You know, I'll just use first person if that's okay.
Sure.
You know, I didn't really understand anything about structural violence growing up, and I grew up mostly in Florida, where there was structural violence everywhere. This is rural Florida, central Florida, but that doesn't mean that, you know, it's that easy to pick this up. And you know, I don't want to throw around terms, but you know, looking back, you understand that even if you come from modest means, there is such a thing as white privilege, with the ability to not have to learn what structural violence means. And when I graduated from college, I went to Haiti, and it was at the tail end of the Duvalier regime, which fell in 1986. But it was still there and appeared to be immovable at the time. It had been around for a quarter of a century, the Duvalier dictatorship. Things kind of seemed frozen. in place. And there was violence to be seen, but it wasn't acute event violence, like a gunshot wound that Tom might address, in an emergency room, or an aggression that Jamie would deplore and then pursue through legal means. This was everyday violence. It was obviously violent. One had only to speak to people who were facing food insecurity or housing insecurity or no job. And they would tell you, they told me in any case, that it felt like violence. And so I got this kind of head start really from Haiti in seeking to formulate, well, what do we call the violence associated with racism, with dictatorships, with abuses of what I later learned to call social and economic rights. And that's what I was hoping to capture with the terms pathology of power and structural violence. And I would add, Don, and I should have said this to you yesterday, I don't feel like I came up with I know I didn't come up with the term structural violence. I cribbed that from a liberation theology, which in Latin America, where I would place Haiti as well, it was an important voice back in the 80s and after.
Excellent, excellent. And I want to ask you, how has COVID-19 affected the work that you do now? Because it's interesting that the United States makes up about 4% of the world population, but in terms of COVID-related deaths, we make up over 20% of the deaths. And so I'm wondering about, and you've worked all over the world, and here, we are in one of the richest countries in the world, and we are dealing with this here. How has that affected what you do?
Well, and it's affected all of us every day, and I'm sure that's true for all of you as well. But just to give a couple of examples, Partners in Health, which is a public charity. I mean, it's not my day job. I've never really worked for Partners in Health. I have a day job. It's an organization that we started in part to address structural violence. This was back in the 80s. And now we're pretty far flung. There are 18,000 people working with Partners in Health. The largest concentrations would be in Haiti and Rwanda, where we have thousands of employees in each of those places. But ironically, perhaps, and I know we did get a chance to talk about this, Rwanda has done superbly in limiting the spread of I was going to say Ebola, sorry. Ebola is still in my mind.
Right.
Limiting the spread of COVID, but also keeping case fatality rates down, which is in many ways a really important marker of the quality of the healthcare delivery system, right? And even Haiti, where the one of the larger hospitals that we run and built in this case, indeed with a lot of help from the Chicago community, including people like Marge Benton, who we all know, that became the national COVID referral center. So there are all these changes programmatically, to use the jargon. But another one, of course, is that we've cut back on our travel very considerably. And of course, we've also been forced to contemplate the cost of pathologies of power in the United States, because they're reflected in the care delivery system, as we all know. They're reflected in the lack or weakness of our social safety nets. And so we knew it was going to be bad at the beginning. And thank you for reading that book, Dawn. I would just say that when folks started talking about the great leveler that would be COVID, anybody who's worked on tuberculosis or other respiratory diseases knew that was going to be false. And in fact, one of my colleagues, Bisola Ojikuto, was already giving talks about, asking whether or not COVID was a Black disease in March, because we knew what was likely to happen. That said, I think we've all been deeply disappointed by the extent of our failure. We know that a vaccine is going to help enormously, but will not address the failures that come out of pathologies of power, and in fact will reflect those pathologies again, which is why so many of us are involved in work laying the groundwork for the vaccine.
Absolutely. And that dovetails nicely with something that I wanted to talk to you, Tom, about. As a White House fellow, you wrote a plan for the U.S. Department of Health and Human Services on reducing racial and health disparities. Because in this country, we still have these gross disparities. Black women and Native American women are 2 to 3 times as likely to die from pregnancy-related causes than white women. You can have a wealthy person who lives in a zip code not far from a poor person, and their life expectancies are dramatically and tragically different. And so, Tom, I'm wondering if you can talk a bit about whether there are any recommendations on race disparities that you would add as a result of COVID-19.
It's a great question. And, first of all, I'd like to say thanks so much for having me here. I'm just really honored to be able to talk about this topic with my colleagues and, in many ways, mentors who have blazed trails in front of me. And I think that part of what COVID reveals are what we already knew, which is society frames our health in ways that extend far beyond our control. So much of our effort is considering what is within the individual or within the individual's control. What we put in our mouths and in our bodies is shaping our health. But COVID has revealed that it is in fact our structures in society that shapes whether or not we are prone to fall ill to the disease and then die if we do fall ill. For some, society's been very protective. It has allowed people to work from home. It has offered them financial support in order to work from home. It's given them safe streets, healthy foods, and for others, they have to run a gauntlet of health risks every day. Mm-hmm. They face jobs that expose them and hurt them. They eat foods that sicken them. There's a proliferation of weapons in their communities. There's nothing but misleading information that guides their behavior, and they live in communities that are absent resources and support. And not surprisingly, that led to much of the disparity that we see in these inequitable both rates of illness, but then also rates of death. Paul mentioned earlier that we're going to require some technologies to get out of this, right? Immunizations have been developed in breakneck speed that appear to be quite effective and are going to be extremely important for all of us to return to safety and our previous ways of life. We've also seen a number of technologies that have changed the way we deliver care, that we've been learning about on an ongoing basis, that have saved people in the last 3 months that we couldn't save in the first 3 months. But the distribution of those resources are going to follow these same patterns of resource that we've seen for jobs and communities and things of that nature. And ultimately, creating a healthy population is going to require a revolution in the way we view our common humanity, where we put people above profit, above finance, and above the caste system that's been serving to organize us. So much of what we've been asked to do so far that have created our inequities are focused on individuals, expecting people to do differently. Please wear a mask. Please don't go outside. Please do these things that are counter what our entire society and social order have been asking us to do, that have incentivized us to do. And we've done very little to change the incentives and structures in which people exist. And that's not actually dissimilar for COVID than it is before. I mean, if you look at the number of books that have been about grit or about improving education, it's about locating the problem in the individual who is the victim, mm-hmm. and demanding that they overcome it, right. As opposed to modifying the systems that they live in. And we're gonna have to see that through differently. Those of us who have the ability and the platform to talk like this, we need to be working on the systems that shape people's lives. And I think that is the main change that we're going to need to see in order to resolve some of the inequities that we see both in COVID, but also in the lives that we lived previous to COVID and that we'll live after COVID.
Absolutely. Tom, often when we're talking about policing, we talk about how communities who need the police or people who need the police the most, there's a lack of trust, and these are communities that would benefit with a better relationship. But I'm wondering, in terms of a vaccine, how do you reach, I mean, there are a lot of people who need the vaccine the most. We all need it, but how do you reach, I mean, can you use technology or some other means to reach people in communities where people may be a bit more loath to take the vaccine?
The issues of trust for Black communities in particular grow from a legacy of exploitation and victimization. And until we're honest about those histories and honest in the way in which we've obscured them and perpetuated them over time, we're not going to get to trust by simply changing the messenger or even changing the message to pleading or demanding or hoping. They're not irrational that my patients regularly come to me and say, you know, is this an experiment? I remember, like, these histories are proximate. These aren't long ago. Tuskegee didn't end until the 70s. Right? This is very proximate. And so I think it's incumbent on organizations to earn trust, to be honest and frank in the way in which they describe both the challenges and solutions. Technology can be a mediator. I mean, I think people gather and use data through social media, for example, which has often been a force for misinformation, but it can also be a force for disseminating truth and honesty and using social nodes in order to help to perpetuate truths and frankness. But ultimately, if we're not willing to grapple with our inequities at the same time, we just poisoned Flint. Like, this isn't old.
Sure.
And we haven't grappled with, well, how did profit lead that? Why did that happen in communities of that nature? We're not going to equitably distribute the best vaccines in an early time frame and talk about, frankly, why they're being distributed and to whom. We're not going to overcome the trust. So it's both. We're going to have to both be frank in ways we really haven't had the courage to be before, and we're going to have to do it now, right? And it's going to have to be through trusted messengers, and it's going to have to use the technology vehicles that also are disseminating, that are competing with news that may actually discourage vaccination.
Absolutely. Thank you, Tom. Jamie, I should say that I've recently met Tom and Paul, but Jamie and I go way back. I met Jamie in 2000 when, Jamie, we were what, 16 or 17? Okay, maybe not. I'm just joking. But I met him because I was a new reporter and I was driving into work and I was listening to Chicago's NPR affiliate, WBEZ, and there was a story about the city installing light bulbs, and one of one of Chicago's public housing projects that has since been demolished. But I knew that there were deplorable conditions that people were living under in the public housing projects, but I did not understand why a story about the city installing light bulbs would rise to a news story, why that was such a big deal. And so when I started to talk to friends and colleagues about going to Stateway Gardens housing project, everybody pointed me to Jamie Kalven. And I got there, and here's this white guy who's there, and he becomes like my conduit to understand what's going on, not just about the lights, but about the conditions. And he guided me through the housing project. I mean, with the least bit of irony here, and so we became fast friends. So Jamie, you have written award-winning investigative pieces challenging the way the Chicago Police Department shields its own and how it wields its power. You have this fantastic podcast and documentaries and this database, which is just outstanding, that tells us about bad apples among officers. They're always called bad apples. And I wonder if you can talk about the cost to communities that need the police the most. And I was just talking a few seconds ago with Tom about trusting the police. But what happens when residents are loath to dial 911 when they don't view, if for very good reason, don't view the police as an ally?
Yeah, so there are a number of different consequences of that. One is that people adopt alternative public safety systems.
Yes.
So under the conditions of abandonment you were evoking a moment ago at Stateway Gardens, which for me, I was immersed at Stateway for close to 15 years. And I think, again, to speak in the first person, was the counterpart in my life to Haiti and Dr. Farmers. And the perceptions come over time. I mean, it's really kind of subjecting you to your subject, being available to the problem, being there from day to day, that brings this sort of cumulative set of perceptions that ultimately crystallize into formulations like structural violence. So the policing is just a part of a larger set of structures and conditions of exclusion. And we should evoke a little more precisely where Stateway Gardens was situated.
Sure.
This was a development at the center of the city. Yeah. And apropos your story about coming down to do a feature on the lights, the installation of lights at Stateway, it was directly across the expressway, which functioned as a kind of moat from, they keep changing the name of it, so I'm not even sure what it is right now, but where the White Sox play baseball. And there were moments when residents were excited because there was a night game across the expressway, because they could navigate the grounds of the development and their buildings, because there was, light shed. It was across the street.
Moon, I remember you saying the full moon was like a big deal.
It was across the street from the Illinois Institute of Technology, a block and a half from the Catholic high school that both Mayor Daley I and Mayor Daley II attended, along with other luminaries in the city. From 2001 on, a block and a half away from the administrative headquarters of the Chicago Police Department. So when we talk about structural violence, particularly in an American urban setting, it's important to have a sense of this, these sort of intimate landscapes that contain vast social distances that we somehow accommodate ourselves to. So, I'm now known somewhat against my will as an investigative reporter. I've joked that I'm really a 19th century novelist who was sort of conscripted into this role, mostly by what I was exposed to at Stateway. But I think it misnames the nature of the work. The idea of investigative reporting is you're going to expose things that are hidden. And really what we're talking about when we're talking about structural violence are things that are in plain sight but not seen. And that's really a different problematic. That's a different problematic. So to go to your question, more directly about trust and lack of trust, in a setting a block and a half from the administrative headquarters of the Chicago Police Department, people depended more on the major street gangs that were in those years much more monolithic and a presence in the development, each controlling different buildings for public safety than they did on the police. And the gangs are a lot of different things, but among them is an alternative public safety system that's archaic, but we have so many different manifestations of. You mess with me, my people are going to mess with your people. The other thing that I think is a bit problematic, and this goes to something Tom said about talking about trust, is the idea that if there were more trust between communities and the police, somehow the problem would be solved. Looks past what we're saying about structural violence. What we're dealing with is a mode of policing that is inherently racist, a mode of policing that aligns with the other conditions we've been talking about, the hypersegregation in Chicago, the conditions of abandonment. It's co-evolved with all these other features and aspects of structural violence. And so it's the kind of policing we have now is not only, an immediate threat in all sorts of obvious ways to people's welfare, it also just hugely constricts people's freedom to live their lives and to flourish as human beings. So what for me was such an education over many years at Stateway was just the radically different conditions of freedom, freedom to live, freedom to breathe. I mean, this extraordinary utterance that has entered into this period when it's as if COVID in some sense did better than any investigative reporter or civil rights attorney in exposing the structural conditions. And then the George Floyd incident occurred in that context, and it was experienced differently than all the other atrocities that we could name. It was seen with at least a momentary or intermittent clarity that to what Paul was saying earlier, with respect to COVID, both Paul and Tom, the cause of death is inequality.
Right.
And the same's true, with the state violence that keeps being produced by this mode of policing.
Given this, I'm wondering how you feel about the whole notion of defunding police, or at least reallocating resources. As you said, if we're talking about something that is kind of, as Harold Washington would have said, races head to toe, hip to hip, how do you work with that system? If you have a corrupt structure, does that demand that you just completely revamp it?
Yeah, so somebody very close to, with a position in the kind of police reform hierarchy said to me recently, the problem is we really need to blow it up, and we can't. Mm-hmm. So the dilemma is nobody would have invented the Chicago Police Department as it presently exists and functions. Nobody would have said, this is a good idea. It sort of metastasized into something that now one has the feeling nobody's really actively in control of or knows how to fix, even if there is some will to do that. I think it's important to hold on. It's so hard to orient oneself in the age of COVID. There's been such, immeasurable hardship and harm, but at the same time, a kind of imaginative space has opened up, a space in which to imagine alternatives, different ways in which we could live together, different ways in which we could constitute and reconstitute our common life in the society. And, defund the police, what everyone thinks of the slogan, which has certainly been rhetorically exploited by defenders of the status quo, what it really is about that imaginative space. There are a huge number of resources that are caught up in law enforcement. A point's been made about the healthcare system, that all the resources, the material resources to fix the system exist within the system, and they're just insanely badly allocated.
Right.
Policing and law enforcement are similar. So there's an invitation to imagination right now, and we should hold on to that space. We don't want to surrender that space.
Mm-hmm. That's excellent. Thank you, Jamie. Paul, Jamie just brought up this whole notion of that we have all of the tools. And it's a matter of reallocating or figuring out how to use them in the best way. I always push back a little bit on this whole notion that COVID has exposed something, and maybe that's, Jamie, that's what you're saying, because all of this stuff we talk about this all the time. I'm so honored to be here, but I'm also angry because it's the same conversation that we've had over and over again. And a lot of this is about will. What are we willing to sacrifice and give and do in order to make these structural changes? Paul, in the documentary Bending the Arc, there was a moment in which you and your team were working to fight drug-resistant tuberculosis. And I believe it was your colleague, Dr. Jim Kim, who realized that the powers that be were saying that this was too expensive. And I hope I'm right about tuberculosis. And then it was Jim Kim who said that he looked to see if the patent had expired on the drugs, and no one had done that before. And it had, and that they were able to get the drugs at a cheaper price. And so I'm wondering how much of that has to do with COVID that we have, and not just COVID, but a lot of different viruses, whether we're talking about the racial pandemic or an actual disease. I mean, how much of this has to do with our looking beyond what we see and what we think we know, and kind of humbling ourselves and just really approaching some of these problems in different ways?
Well, first of all, that's an entirely accurate recollection of the exchange. And, when Tom said, changing the messenger and even changing the message is not really going to do what we need to address we could call them social, cultural pathologies of our nation and our world. I believe that. And I think that one of the things that all three of us are saying is that in focusing on individual agency or choice, the ability to make them, when are we obscuring the inability to make choices, the inability to have agency because your house isn't big enough, as Tom said, when you're called to shelter in place, or suddenly you're an essential worker, not so essential, however, that you would have proper unemployment and health insurance, and the tools of the trade required for protection. So I think each of us is going towards what we might as well call a material analysis or a materialist analysis of social phenomena like mistrust. And to ground this in the example that you brought up, Don, when you start reading about Germany having, this high level of trust in government, I don't know that a historical analysis of levels of trust in Germany would occasion, a lot of confidence about that. But they do have a lot of ICU beds, right? They do have a national health insurance system. They do have unemployment benefits. And so I think each of us is saying, we have to be very careful to attribute these structural problems, which are material problems around around freedom from want, to go back to Jamie's formulation. We do have all of that work to do, but we have a vaccine right now, right? So do we need the people that we're trying to help be experts in vaccinology and the immune response to, an antigen and a COVID vaccine? No, we don't. We need to make interventions that will protect people, right? And the long slog of altering the way we see each other, getting back to the very poetic thing that Tom said about we really have to reimagine how we all live together, which of course is what Jamie has been doing in his work for a long time. We need to do that as we do other things, around, the kind of stuff, again, I'm just going back to Tom's experience, things like the ACA or health insurance, things like building a trauma center in a part of Chicago that needed one. And, as an anthropologist, I'm supposed to be interested in the cultural shifts, and I am. But I really think we also have to buckle down and think about how structural violence works in families and communities and cities and nations and in the globe. And that is often through material pathways. And, I think that's something that we're all underlining, coming at this from very different angles, and you are too, Don. So I'm sorry if I went off on a little jag.
No, you're just fine. And
well, let me just say one thing from Ebola in West Africa. There was a massive epidemic of mistrust, and it had all the contours that Jamie and Tom described and you described. In the story of honesty is just so heartbreaking, right? in West Africa, they were 10 years out from a brutal civil war. And it was a while before, I'm embarrassed to tell you, before I realized that every single adult Ebola patient that we had and cared for had also survived a brutal civil war, right? So the project of declaring peace it was an important project. But without peacekeepers, how effective would that have been? There were, peace accord after peace accord after peace accord, but without the material presence of peacekeepers, didn't add up to anything compared to the blood diamond funding for the weapons, et cetera. So, when we faced Ebola, I was already very skeptical about hectoring people or shaming them or lecturing them about why they need to do X, Y, or Z things. And there's the same list
Sure.
that was mentioned by Tom, right? Social distancing, PPE, et cetera, et cetera.
Mm-hmm.
What really made a difference was making sure that better care was available to those afflicted. Otherwise, why would they trust the system that has failed them every time? It was full of, by the way, you look under colonial rule, it was full of treatment units that had no treatment in them, care centers that had no care. It was all about isolation, quarantine of the natives. And we can see the same kind of, colonial language in looking at health disparities within the United States. We've heard it again and again. So I think this focus on the material and on people's needs is an important starting point for a lot of the work that we need to do.
Excellent. Thank you, Paul. Tom, I was talking to you, I want to piggyback on this whole notion about health disparities, because in this conversation, we've been talking about Black and brown people, but there's a considerable amount of white people who also have health disparities. There's a book called Dying of Whiteness, How the Politics of Racial Resentment is Killing America's Heartland. Yes. And the author interviews poor white Midwesterners, I believe from Kansas, Missouri, and Tennessee, and analyzes health data, and learns that white folks would rather die themselves than support policies that would betray their political beliefs and help, as one man put it, Mexicans and welfare queens. And we've seen this dynamic in some Trump supporters' decision to not wear masks, the politicization of science. And so, Tom, I'm asking you, when we say that, I'm wondering if we can talk about the dynamic of whiteness and caste and how it dovetails with your thinking regarding the Overton window.
Yeah, I mean, this is a really challenging question because it gets to the heart of who we are as Americans. And more than who we are, who we think we are. Right? Because we're a society that has fundamentally always been in tension between our best and worst impulses, right? So our founding documents are these soaring languages about life, liberty, and pursuit of happiness, about the intrinsic value of an individual and how all humans are created equal, and yet it was founded on stolen land and exterminated indigenous people and enslaved folks in order to build its wealth. And we've never been honest about any of that ever since. We've told ourselves many stories, not just in our history books, but also in our art, in our music, that help to shape who we see ourselves as and why. So much of this is not only comes from the art and then turns into justify, the art is and the words are used to justify these unjust structures. But then when it comes time to undo these things, we tell ourselves different stories, right? We really want, Black lives do matter. We really want equity without doing the hard work of rebalancing those resources and reshaping our structures. We often embark on educational campaigns. These aren't misunderstandings, right? These aren't things that you can just teach your way out of. Jim Crow wasn't just Black folks and white folks didn't know each other well enough, and if only we bring people into the same room, that would just disappear. These are structures of power that are tied to race and identity in ways that are intrinsic to our Americanness. And addressing them requires that we get right into who we are as Americans. And that will both have to be reflected in our histories and our art, just as the way they were structured, in order to narrate change in the structures that we need. We need to rebalance our cities. Segregation is just such a pernicious, long-standing, and damaging way to organize society by race that allows for common goods that are shared by taxpayers to be maldistributed. I mean, we think often about, the white pools of the 60s, where, so much of it was, oh man, these Black kids and white kids don't get to play together. It's, they'll never get to know one another. But those pools were subsidized by Black taxpayer dollars. I mean, it wasn't just that it was unfair and bad to our society that people would get together, but these are common goods that were misallocated. And we're doing that even today with our common goods related to taxes. And we talk relatively commonly about how we need to get rid of that. But are we ready to do the hard work? Are we ready to actually recognize that it's not about, we have to liberate ourselves from these constructs of race and caste in order to recognize a shared humanity that then gets away from this zero-sum competition for resources.
And I remember Dr. King at one point saying to poor whites, especially rural people, that you all need to be out here marching with us, and that's where you should be. But they didn't.
I was just going to say, I think the upside is the one place that can happen is healthcare.
Yeah.
I mean, I think that's the one place. I mean, first of all, until there's justice in society, there won't be justice in health, right? I think that goes without being said. But I think that within healthcare, that's the one place where, we have the chance to lead, where we can, where injustice is demonstrated in our physical bodies, and where we can let our best natures be led by fact and science in ways that they're not anywhere else. And we can elevate these facts that are born in our bodies to promote our shared humanities in ways that we just can't see anywhere else. And so COVID helps to be a platform for that conversation, but it's one that needs to then disseminate throughout society.
Absolutely. Thank you, Tom. Jamie, I believe that this will be my last question. I want to piggyback a bit on something that Tom said about the stories that we tell ourselves. And I know that the media have played an enormous role in one of the reasons why people who wield power, they're able to do it so expertly, is because of the narrative that has continued throughout various media, whether it's in the news or Hollywood, this idea of rugged individualism. And the people who do well do so because they work hard, they are industrious. The people who don't do well, Black people who don't, are the opposite of that. And so in various ways, sometimes artfully sophisticated ways, the narrative, this narrative has been perpetuated in the media. And when it comes to policing, there's this unequal distribution of the benefit of the doubt. And so, Jamie, I want you to talk a bit about the media's role in giving cops, the police officers, the benefit of the doubt, and not poor people, and how this has played out for a long time, and the role that video has played in coming very close to leveling the playing field. Because I remember there were a lot of people who would say to me, well, readers, when I wrote for the newspaper, well, what happened before the video started rolling? And so that's kind of this whole idea that the institution can't be wrong. The police officers can't be wrong. So Jamie, I know there's a lot there. So can you speak to that?
Yeah, so and I think we want to be sure to leave time for questions.
Yes.
So I'll try to be brief. I think one of the things that's emerged for me over time in covering patterns of police violence is that one of the principal ways in which power imposes itself is through narrative. Narrative is a hugely powerful tool. You think about our experience here in Chicago in the aftermath of the Laquan McDonald murder, we can now call murder, by police. It was almost as if the entire machinery of the city was dedicated to maintaining a false narrative about what had happened. So we see that in the microcosm in the individual case, and then we see it in the macrocosm in what you were referring to, a set of larger narratives where there's a presumption of guilt of the victims of police abuse of various sorts. I think right now there's also a larger media phenomena of just a kind of hallucinatory realm that we all get sucked into. And there was one point that I feel like we haven't touched on that I want to touch on at least briefly before we move on, which is that, you know, as I understand Paul's practice over many years in Haiti, and certainly ours on the south side of Chicago, it's really been grounded in valuing local knowledge, in listening to the victims of abuse, in kind of withdrawing from the gravitational field of the larger chaotic media discourse, and trying to come to a deeper, I mean, it's almost like, when I think of those years at Stateway, I almost think of it as this extended act of listening,
Sure.
as opposed to some other way of formulating it. That's the practice we've tried to maintain in the Invisible Institute. And so, you know, it's critically important to bring into the public discourse the voices, the stories, the perceptions, the perspective of the people who are, I'm not going to use the term victim, but those most affected by the policies and practices that we deplore. And I think that can only be done by really being grounded in place, by, you know, engaging directly with your place, your community, your environment. And, you know, one of the ways I thought initially and to this day about the work we did at Stateway was it really was an exploration of what it might mean to be a neighbor under conditions of urban apartheid.
Sure.
And I think there's power at this moment in that fundamental notion. We sort of all know how to be neighbors, and there's a language of neighborliness, and there are ways of building relationships through that language, but we define our neighborhood so narrowly.
Absolutely.
So, you know, I would juxtapose with the media chaos and hallucination, and we've all been, these last 4 years, almost struck dumb by the media spectacle.
Yes.
You know, it sort of has sucked us out of our own reality. And I would juxtapose with that the importance of local knowledge, the importance of claiming the agency one has as a neighbor in the domain of everyday life, where we really have some ability to act, engage, to cross boundaries.
Absolutely. Thank you, Jamie. So I want to offer up our first question. It's from Linda. And the question is, pandemics have often fueled significant changes as people try to grapple with them. Still, if we consider several diseases that we could control and halt transmission or eliminate, for example, TB, HIV, we still find the differential health status based on oppression. To what extent do you think that the tendency to medicalize these issues, for example, vaccines for COVID, allow us to continue to ignore the structural power relationships that cause these inequities or inequalities? Tom?
You know, I think it's a profound question. There's a component of chicken versus egg here. I think that the issues that create these inequities are so intrinsic to our society that to address them head on would be quite dangerous to so many stakeholders who are benefiting from the current hierarchies and allocations of resources. And so we use tools that are safer, that are neutral, that are not unnamed, and that are quite distant to reallocating so many other components of our society. I think we see that similarly in education, for example, where we see similar huge inequities that we could solve tomorrow. And instead of saying, you know, these are about power and resources, we look within a textbook or a classroom for the solution. And here we're looking within a molecule or a body for a solution that is a societal challenge. And so, you know, the chicken and the egg component is, what would it take for us to be that frank about what is going to be required to create equitable healthcare systems or health status that removes us from, if I allow you to win, that means I must lose component that exists in so much of the competition in a capital structured society. And then how do we then get away from that? Because, you know, in the meantime, certainly technology is going to be a part of every solution. It's an inevitable component of our society, but it can't be the driver. It has to be a part of society.
Mm-hmm. Excellent. Thank you, Tom.
And can I add one thing?
Sure. Absolutely.
No, I just want to acknowledge that, you know, medicalization can serve, you know, many purposes, right? And it's possible to reflexly criticize the medicalization of a social problem, but it isn't always the worst thing we could do. For example, with addiction, which would you prefer, a medicalized response or a legal response that has people locked into prisons and jails? So, you know, I think sometimes it is convenient to medicalize something that's a social problem, in part for the reasons mentioned earlier by Tom, that in the healthcare arena is one area where we could possibly push forward this utopian vision of a more egalitarian, just society. And I agree with that. And understanding, of course, that it's possible to medicalize a social problem with poor outcomes, but it's not always poor.
Well, and it flows with the what we were talking about, the different response between people, when you're talking about addictions, people who are addicted to crack, for example, who are predominantly Black, versus people who were addicted to opioids, predominantly, I don't know the stats, but white, just this difference in the approach, whether it's a medical approach or a legal approach. And we can see how that has devastated communities. Jamie, I'm going to throw this question to you. It's from Ted Eccleston. I'm hoping I pronounced that name correctly. What stories or narratives can we turn to help us reimagine who we are?
Wow. You know, there's not a simple answer to that. I think in this cultural moment, there are lots of people thinking about how to reposition narratives and escape from some of the conventions of the stories we already know. You know, I really would recur to what I said earlier, which is, and I think this is a fundamental question, Dawn, for people like you and me as journalists. It really has to do with what our relationship is to other people's stories, and the recognition that it's always somebody else's story.
Right.
So, you know, we think about it a lot at the Invisible Institute, which is, you know, how to make immediate and artfully accessible to people the lived experience of those who we all in solidarity with, and not to be too much of a sort of mediating structure or voice. So there's a formulation. I suspect my colleagues here have been called this as well. You know, to be a voice of the voiceless, which I find completely repellent and a complete misunderstanding of the nature of our cultural and societal dilemma. People don't lack for voices; they lack for people listening. Mm-hmm. And it's a very different dynamic.
I think that the other part of this, and I totally agree with you, right? I think that the other part of this is how we tell the stories. Who are the heroes? Who are the villains? Yeah. And then where do we start the story? Do we start the story at the pathology, or do we take the long view where we start to understand how things got to where they are? And all of, as a storyteller, as a journalist, as a person who wants to change the narrative, I think all of those things are important as well.
Well, if I could just add a word to that, Dawn, sure. I think that one of the conventions about stories that, and we contend with this in the police space, that is problematic is the notion that there's always a villain. Mm-hmm. There's a villain who explains the bad outcomes, the terrible things that happen. And I think if we're taking a more systemic view of structural violence, of systems that perpetuate and keep reproducing inequality, then there's a need to situate ourselves inside those stories and recognize that the problems don't exist apart from us. And that, those are complicated stories to tell. Those aren't stories about individual bad actors, although they include some bad actors. They're stories about the nature of bureaucracies and systems. So I think one of the challenges is how to make those stories as narrative completely compelling.
And the systems that allow the bad actors to act.
Right.
Yeah. Do we have time for one more question? We'll try. So this one comes from Anonymous, and it says, in light of social media's recent efforts to contain the spread of misinformation regarding COVID-19, how do you think it has succeeded or failed in sending the right message to marginalized communities? Tom, Paul?
Did you say, how has the misinformation failed?
Yes, from social media, and the messaging that people are getting from social media.
Well, I mean, I think if you, just to stick with one theme that I know fairly well, if you look back at the history of epidemics and pandemics, well before there were social media, there were epidemics of misinformation and lots of mistrust. Mm-hmm. So, I mean, I think that, when we talk about technology, we're not just talking about social media, of course, and that it's really been more echoing and amplifying misinformation. It would have been around anyway, at least based on previous experience. It will have to be addressed, but again, we need to make it clear that addressing misinformation is not the same as, rolling out a vaccine, or just back to in South Africa, after apartheid. I mean, apartheid did not have its effect on populations through disdain. Mm-hmm. It was through material processes yet again. So I think you could class the misinformation as very successful, and probably a lot of it targeted, but it would have happened anyway, regardless of what were the mechanisms by which rumor, gossip, innuendo, and falsehood are spread. So I think we have to do this work anyway and use those media as best we can.
Absolutely. Well, thank you guys so very much. Thank you, Jamie Kalven, Dr. Thomas Fisher, Dr. Paul Farmer. And I'd like to thank the audience for joining us today. This has been my great honor. To learn more about Jamie Kalven and the Invisible Institute's critical role exposing the police cover-up of Laquan McDonald shooting, you can view their Emmy Award-winning 2020 documentary, 16 Shots, on Showtime. And if you'd like to hear more from Dr. Thomas Fisher, he has a forthcoming book in 2021 in which he writes to his Chicago patients directly and discusses his recommendations for revamping America's healthcare system. The book will be published by One World, an imprint of Penguin Random House. And to be sure to read Paul Farmer's new book, Fevers, Feuds, and Diamonds, Ebola and the Ravages of History. You can also learn more about Partners in Health in the 2017 documentary, Bending the Arc, available now on Netflix. And because I am not beyond making a shameless plug for myself, my memoir is forthcoming from Simon & Schuster in September 2021. It's called 3 Girls from Bronzeville, and I didn't want the memoir to be solely based on memories, so I conducted hundreds of hours of interviews and poured over hundreds of pages of court documents to tell the story of 3 girls coming of age in the promising glow of the post-civil rights movement, and who make different choices and land in very different places. Thank you all so very much for your time. Stay well.
Thank you.
Thank
Bye,
you.
everybody.
Take care.
Thank you.